Hello and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and today I am delighted to welcome two guests from Safe and Sound who'll be talking about Safe and Sound, the impact of COVID on Safe and Sound, and future initiatives. So I am delighted to welcome Sharon Maddock and Trisha Wright. Thank you both for being on the program today. I'm wondering if you can tell us a little bit more about yourselves and the role that you play at Safe and Sound, where Safe and Sound is located, and some of the services that you do. And then we're going to talk COVID. So again, welcome. Who wants to go first?
Absolutely. Sharon is our new chair, so I think it would be great to let her introduce herself first, and then I can pull back some of the information since the last time we talked last year, what's been going on, and catch you up to speed.
Excellent. Sharon.
Hi there. Yeah, so I recently became chair at our annual general meeting in November. So I'm still learning, I'm getting up to speed. And I've been involved with charitable organizations on board of directors of a number of them, and volunteer through the decades. And I especially have a heart for those who are on the streets, the less fortunate, who are suffering from experiencing homelessness and suffering from addictions and mental health issues. So so that's where I'm coming from, and I'm looking forward to spending quite a few years hopefully in this position and helping the organization grow bigger and better.
Excellent. Trisha, your role at Safe and Sound.
So my name's Trisha. When I spoke with you guys last year, I was actually the chair then, and I stepped down, and I've now moved into the capacity of the administrator at Safe and Sound. Mm-hmm. Yeah, so I really love Safe and Sound, so that's why I decided to stay. And there's just been so much that has been going on in the past 12 months. And so I guess some really big news that we can share, there's a couple things. A goal that we've had for quite a few years was to purchase a building. And we actually did that February 1st. Sharon took the check down to the lawyer's office, and it was just a celebration, for us to have finally completed that goal. The second really wonderful thing is that coldest night of the year this year has actually brought in almost double than it has ever in the past. And so I feel like we have really positioned ourselves in the community. And I think that people are really valuing the services we provide, and that they're becoming more aware of all of the services that we do, because a lot of times people are so shocked when they realize everything that we actually do. So.
Yes, I'm delighted for you, because I think this is just an amazing success story in spite of all of the challenges of COVID and everything, to be able to certainly celebrate owning the building, but also the increased community profile to be able to identify the important role that you do. Can you tell us a little bit more about what Safe and Sound actually does in the community? Because I'm sure there are people here who are watching who may not be aware of all that you offer.
Well, here's the thing that's really interesting, and I'm just going to start really with that population demographics that we're seeing, okay? So with COVID, when that started in 2020, we used to not have a cap with the capacity of people that were in the building, because we didn't have the social distancing and all of those protocols in place. So we knew, and we really identified, like when COVID hit, we were like, if they have to go to the bathroom or just do something basic, like even like a shower, or there's nowhere for anybody to go. So that's why we decided to stay open. Now, we had to cap it because of the social distancing. So where before we would see on average 60, 70 people, there were times where we were down to only 5 people in a rotating shift every half hour that were allowed to go in. And so what's surprising when you know that is the fact that we still serviced in the last 12 months 10,942 people. And that's with a cap. So we're operating at probably 30% of our regular capacity. So to me, I was just, when I see the stats, I was just like, wow, like it's amazing. But as I said, we really identified that. Now, what we've noticed though, Carol, is before COVID, the population that we generally saw was people living in poverty, some mental health issues, some addiction issues. A lot of times it would be that older crowd that would come in because they're lonely. So when we track our data, one of the questions we ask is, why do you come here? Over 80% of the time, the highest reason people come is to decrease social isolation and just to connect and have a cup of coffee. But what's changed is we now are seeing the majority of our people are between the ages of 15 and maybe 35. The majority of our people are struggling with addictions and mental health. Whereas before it was a more calmer kind of environment, with the increase, like the fentanyl, the opioid epidemic is really impactful, and we're really dealing with that with every day. We've actually have probably saved 5 lives in the last 8 months by having to administer Narcan on site.
Wow.
So this is what I'm saying, like, if things are changing and we're adapting as quickly as we can. So one of the things that we've done, because one of the things we noticed was that, you know, it's not as calm of a space as it used to be, but with somebody who has mental health issues or addictions, one thing they really need is they need somewhere they feel safe and stable and calm. And so one of the biggest changes that we made too is in the back room, we had a lot of racks for clothing and stuff for donations. We cleared that out, and now there's just like part of that room is for the donations. So people will now ask. Now, I was worried that we might not get out as many donations, but we still gave out over 2,000 donations last month. But here's where we changed it. We've created a calming space. So people who are in psychoses, or they're coming down from drugs and they're fidgety and they're uncomfortable in their skin, or the stimuli of loud noises is impacting their psychological health, we now have a worker there full time in the back, and we have up to 5 people. They go in the back and they offer them de-escalation skills, calming skills, fidget toys. They have movie nights. So that is how, you know, we're kind of tackling this new population that we're seeing coming in and trying to meet their needs, going beyond just giving those basics, you know, shower and this and that. We've also hired a community health and wellness worker who is a nurse. And so now people will sometimes come in with, you know, sores or, you know, just some superficial stuff that needs taken care of. So we have somebody there now 5 days a week that can help them, not only with their mental health, but the physical part of it. Yeah. She also is now offering counseling as well, which is something new. And on Tuesdays, the nurse practitioners from the Grey Bruce Health Sciences, they actually come in as well. So that's kind of new too that we're doing.
Yeah. So you're describing an organization absolutely changing and adapting to the needs that you're seeing, and in a fairly quick turnaround time. That's remarkable, actually, because at a time when a lot of people kind of hunkered down over COVID, you're reaching out and you're providing that care, which is remarkable. Sharon, I know you're new to the board, but as chair of the board, that must be an exciting time and a challenging time to be on a board and responding to the community needs. Who sits on the board with you?
Well, it's a variety of people. There's 6 directors on the board currently. We have one person who is a university student who is studying global, I can't remember, it's global poverty and international development issues. We have someone who is responsible for the fundraising. She works at the radio station. We have another person whose son was a participant at Safe and Sound. And we have another person who has been on the board before, and she came back from maternity leave. So we do have some people who have experience, and then thank goodness we still have Trisha, because I mean, it's a relatively new board. There's been a lot of change over the past couple of years, but it's great to see how everybody has sort of found their own niche and how we're adapting. And prior to COVID, things were the whole organization operated quite a bit different because they used to provide a warm meal at lunchtime. That actually changed into what we call grab and go bags, which would typically be things that you can eat, but not in the space because of public health regulations. We would just be able to give them a bag and they'd have to bring it outside to eat. It would be like a granola bar and yogurt and juice box, that kind of thing. And the same with the breakfast. It would just be like oatmeal and that sort of thing. So those things, hopefully we will be able to bring back hot meals once the whole COVID thing settles down. And because of having to adapt to the regulations, we've also been encouraging participants to get vaccinated. One of the things the public health nurses do is they do vaccine clinics. So not only the COVID-19 vaccines, but they do all, the whole gamut from TB, hepatitis, the whole range of different vaccines that would be useful for folks who aren't able to access healthcare on the same way that maybe you and I would. So we definitely recognize there's a need there, and those folks they still need our help, even though we might have to change that way in which we do help them. So we've gone from at certain points that we were only able to do door service. Handing people stuff. When we've had a COVID, every now and then we would have some experience with folks who actually came down with COVID. And so then public health would say, we have to go to a door service and you can't have people coming in and eating or drinking. But we're back to eating and drinking now, which is nice to see, because then people will sit down and have coffee and then they'll chat. And I was just there the other day with one of our volunteers, and she likes working and volunteering, and she really enjoyed sitting down and talking to one of the folks, and he told her about his journey about getting off of heroin and being a successful ex-addict. I don't know if that's the right term, but certainly that's part of it. That's part of the whole experience, and we're just there for the people, and we do whatever it takes.
Yeah. The other part, and correct me if I'm wrong, Trisha, but your hours of operation have also changed, correct? Your longer hours, and you offer like warming centers through that sort of service as well, correct?
Yeah, so as I said, with changing population, one thing I did was I went back to the county and I said, we really need another staff in the back, right, to monitor things for people's safety. And the other thing we really wanted to do was expand into Saturdays. I know that when I'm in the office working, even on a Sunday, that phone does not stop ringing. And so, with the winter months too, it was like, can we partner up and do something for, out of the cold, right, a warming? And so right now, the county has been great. The city's been very supportive. We have offered those services. Right now, we are in the talks about what that's going to look like next year. The goal is to actually be open 7 days. So we'll see what happens with funding, whether or not we're able to do that. But I just want to actually piggyback too on Sharon's comment about the grab and go bags. When we're talking about we really do have a very unique business model and the way that we approach things. So one of the things that we also identified as a gap was that, if you're homeless and you're hungry, you go somewhere, they hand you your food and that's what you get, whether you can't eat it or not. So where our grab and go bags are different is we offer gluten-free and we also offer sugar-free for people with diabetes. And then we also offer, and it's expensive, but we offer protein drinks because sometimes we have people who, have, lost their teeth and they're unable to chew, or they have digestive issues. So, once again, we always look with the staff, we look on probably a monthly basis to identify any gaps. And then what we do is we then identify it. We're very solution focused. We will consult with the staff, and then the program manager or myself will then take it back to the board for them to make the decision based on recommendations. And one thing we're really grateful for is this board. It just has so much knowledge and they're so passionate that things are getting done. So, and just moving back too with our staff, one thing in the past that, we perhaps were questioned a little bit about was, we have the philosophy that, when people get better, a lot of times people are like they want them to get better, but then they get better and they go to get a job and maybe they have tattoos or they don't have work experience. So you get better, but nobody wants to give you, an extra job, like an extra helping hand, right? So we really truly believe that people with lived experience can be the best employees out there. And so we try to, as much as we can, get people who have lived experience so that they're bringing that perspective. Because if you go into Safe and Sound, and sometimes we'll have a bit of a high turnaround in staffing, but I think it's because a lot of people, they think working, with this population is going to be really easy. It's going to be fun. It's going to be, and they don't realize that we have a lot of people who have a lot of trauma responses that sometimes come across as angry. They don't trust. So connecting's not easy and it can be very difficult. And so that's why sometimes we have staff come and then within a month they're gone because they're like, I just can't do it. We on average have 1.7 crises per hour.
Say that once more. I need to make sure I heard that.
On average, our crisis worker was doing, the stats showed 1.7 acute crisis per hour. So in order to meet our staffing needs, we used to have a full-time crisis line. We've dissolved it for this year. We now have 3 staff that are sharing that responsibility because we don't want burnout or vicarious trauma to impact our staff. But as I said, I don't think people realize those things. So,
and that's really why I wanted you to emphasize that, because that is a significant number. Speaking of numbers, I wanted to go back to the numbers you quoted earlier, and I scribbled them down. But at 30% of function, I think you said you handled 10,000 visits. I'll call them visits.
10,942 people. Yeah.
So at full capacity, let's say 6 months down the road, hopefully we'll be through COVID restrictions and you're at no restrictions, full capacity. What do you think the numbers might look like?
Well, see, this is where it varies. Now, I've been tracking the data since 2016 in order to find a trend, okay? Yeah. So the variance that's happened now is with COVID, we've expanded our hours by about 40%. So that's why you're seeing that 10,000. But when we pull back and don't have the evening hours again, and it's just a daytime through the summer months, I myself am very curious to see how that looks, Carol, because, once again, I'm going to go and look at all that. But I would anticipate, like on average, we've always had, as far as I can remember, just with the daytime stuff going on, at least 8,000, 9,000 a year. Yeah. So
that is a lot of visits. And I think, funding, you talked about the county and municipality, but where does your funding come from? And how can the community support what you do and the increased demands of the service based on what COVID has, the impact of COVID on those who need your service?
So now this is going to probably shock you because it still to this day shocks me. We only get a guaranteed $50,000 a year base funding. That's it.
From the counties.
Mm-hmm.
Okay.
And it takes us approximately $250,000-300,000, on average $25,000 a month to operate, and that's operating with a skeleton crew of staff, doing, just doing the best we can. But the thing is, it's like we're so innovative that we always come up with ways to make things work, right? And we have such kind people in the community that they will donate what we need. So we're able to say, we really don't need any more clothes. We spend so much money sending that stuff out, but we need food. And if we ask, they bring it. Or the coldest end of the year, that was great. What helped us during COVID was that excessive funding that the federal government put down. And so with that, that's how we expanded our staff team and we're able to meet the needs better. And then Josh at the county has been amazing because even though that funding kind of dried up, when I went back to him and said, can I get a grant for this staffing and that staffing just recently, he was like, here you go. Without his support and United Way and Grey Bruce, foundations and the community members, we would be back to where we were in 2016, which is just one staff running the place.
Yeah.
Right?
So, and I'm going to put a plug in for you,
Yeah.
so that people who are listening who recognize that there may still be increased needs after the restrictions because of the situation around mental illness concerns that affect all of the population. We know you're dealing with vulnerable people, of course, but not everybody recognizes the impact of COVID on mental health and addiction. So assuming just because we don't wear masks in the future does not mean that those services are not going to be required to address our vulnerable people. If people wish to donate to continue to support Safe and Sound, how do they do that? In a financial way?
It's so simple. So you just go to our website and there's a whole page for donations. You click on that button and it will immediately, through Canada Helps, give you your tax rate and the funds come to us.
Okay.
And just, when we're talking about the mental health, I think it's important to add in and just to honor those people that we've lost. This year, we've lost 46 participants to overdose. We average 4 deaths a month. And so if you can imagine going to work or volunteering and you're talking to somebody one day and then all of a sudden they're gone, the impact that has on the participants, the staff, is quite a lot. So when we talk about the needs, I don't know if it's because people with COVID got isolated and drug use got more, or if we're just seeing it more. I don't know what happened, but I do know the past year, it's been really rough.
Yes, and to honor those who have passed away and to recognize that their challenges day to day to just survive, are remarkable and difficult sometimes to grasp. Would you say that the community, as a result of COVID and the fact that we have an issue with addictions and overdoses, would you say the community attitudes are changing around services you provide, or are you finding that there's still opportunity for growth and change in attitudes?
Well, I think because the opioid, the epidemic doesn't say, hey, it's only, the poor people that are going to get addicted. It's not, this drug touches everybody. So I think a lot of people in the community have known somebody that's been affected by addictions. This isn't something that isn't common anymore, unfortunately. And I think that may have changed a lot of the perceptions and a lot of, those feelings towards, I would imagine. But then, obviously you still have people that, sometimes we'll get a letter and it'll be like, we don't want you downtown. We want to move you out to the country. And because and then we're like, you know what, if you don't want people on your streets in front of your stores, keep us open because they can come here. Right.
Exactly. There's an open, welcoming place for them where they can get help and services. Mm-hmm. Sharon, I would think, based on certainly what Trisha's describing as far as the model and the changing and evolving model, that as a chair of a board, it must be energizing to make decisions that have such an impact on the everyday lives of those who need help and services the most. I would imagine that, that may not be the experience with every board. You mentioned you've had experiences with other boards. How would you respond to your experience about this?
Well, certainly it is energizing, especially so we not only have the drop-in center, that's on the first floor of our building, but the second and third floor we also have transitional housing units, and so these are units where people who are clean and sober can stay at a very subsidized rent. It's very, very reasonable. So it's a transition between being on the streets and then being able to afford their own apartment. And it's actually really gratifying when you see the folks who are able to overcome their addictions, stay sober, and be able to, a lot of them then will be in the space as well. They'll come for coffee and they also need the human contact. But when you see them leaving after they can stay up to a year, and then being able to be, able to afford to get their own apartment and take care of themselves, and you feel that you've played an intrinsic part of that. And that's really, really gratifying. I mean, every single person who overcomes, I mean, there's a lot of different things to overcome. Just if you just, contribute one little bit to that recovery story, that is so gratifying.
Yes.
And just making people, better able to live, even if that means we give you a tent, a sleeping bag, and backpack full of supplies and even substance, Narcan kits, a little first aid kit, that kind of thing. If that's all we do, that still is a positive impact on that person's life, and it makes their life easier. And so I think it's really important for us to meet people where they are. Because a lot of people, aren't able to get clean and sober and be able to access the housing, the transitional housing support. But having said that, if their living condition is a tent, maybe that's the best that they can do at that time in that place. But we're giving them a hand. We're giving them the ability to live a little bit better than they would have if they hadn't come and accessed our services.
And certainly I know, you have signs in the windows that say it's a safe space, and that it's a place where people are respected, right. And that respected, it's just what happens there. So in the last minute, what closing comments would you like to give?
I think the whole the future of Safe and Sound, I think, is going to expand. We're looking forward to being able to partner with more community groups and be able to do more and be able to provide more programs as we are able to afford it and very able to get the staff to do, because there's just so much need out there.
Yeah. I want to thank you both. This is so informative, and I want to invite you to come back and tell us more about how you're doing, how your programs are growing, and how the community can support you. You're providing an absolutely essential service to those who need it the most. So thank you. Thank you for joining us today. Please join us again to learn more about services, programs, and resources available to you and to your family. Take care and stay safe.
This program is brought to you by OHL Action Pack. Looking to see tomorrow's stars today? Follow the teams and players you want to watch. OHL Action Pack is part of the Rogers Super Sports Pack.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
Barlow. I'm a right winger with the Owen Sound Attack. Get great OHL action on Rogers TV as we bring you Owen Sound Attack games live, both home and away.
Cottage Life is in free preview.
Perfect.
Don't miss huge premiere events as fan favorites come back for more.
Long time no see. Woo-hoo.